The MRI came back clear. There's no structural abnormality. In plain English, the scan didn't show anything that shouldn't be there.
So, nothing serious.
Nothing serious.
Hello and welcome back to Medical Voices, the show where we learn the language of healthcare through real conversations. I'm Tom.
And I'm Nadia. Great to be back.
As always, before we start, everything you hear on Medical Voices is here to help you learn the language of medicine. Nothing in this episode is medical advice.
We're passionate about medical language, but we're not your doctors. And today, we are in the hospital.
If you have been with us, Mr. Davies has had quite a journey. First, GP appointment with Dr. Bennett. Back with new symptoms, headaches and dizziness. Admitted for an MRI. That was episode 4 and 5. Today, the results are in, and Mr. Davies is going home.
I'll be Dr. Patel today, and Tom will be Mr. Davies. Episode 6. Discharge Instructions. The language of leaving hospital safely.
10 terms, a full discharge role-play, 5 language breakdown points, and a quiz. Let's get into it.
Before we get into the dialogue, let's make sure we have the right words. 10 terms. I'll give you the term, the definition, and an example. Pause and repeat whenever you need to.
Terms 9 and 10 are ones we've covered before. We'll flag them when we get there.
Term 1. Discharge. The formal process of releasing a patient from hospital care once they are clinically stable and a safe plan is in place. As a verb, the doctor discharges the patient. As a noun, the patient is ready for discharge. Both forms are standard in clinical English. Example: Mr. Davies was ready for discharge by midday. All his vital signs were normal.
Term 2. Discharge Summary. A written document prepared by the clinical team at discharge. It summarizes the diagnosis, the treatment the patient received, any changes to medication, and the follow-up plan. It goes to the patient and to the GP. Example: Dr. Bennett handed Mr. Davies his discharge summary before he left the ward.
Term 3. Follow-up appointment. A scheduled consultation after discharge with a GP, a specialist, or a clinic to monitor recovery and review results. Example: Your follow-up appointment with your GP is booked for 2 weeks from today.
Term 4. Prescription. A written or electronic instruction from a doctor that authorizes the patient to obtain and take a specific medication from the pharmacy. Example: Dr. Bennett gave Mr. Davies a prescription to take to the pharmacy on his way home.
Term 5. Warning signs. Specific symptoms or changes the patient should watch for after discharge. Symptoms that could indicate a complication and require immediate medical attention. Example: Dr. Bennett listed the warning signs clearly: sudden severe headache, visual disturbance, or confusion. Come back immediately.
Term 6. Activity restrictions. Specific limitations on physical activity advised by the clinical team during the recovery period. For example, no heavy lifting, avoid driving, limit stairs. Example: The discharge summary included activity restrictions for the next 4 weeks.
Term 7. Wound care. Instructions for keeping a surgical or procedural wound clean, dry, and monitored for signs of infection during recovery at home. Example: The nurse went through the wound care instructions before Mr. Davies left the ward.
Term 8. Medication schedule. The timing and frequency of medications to be taken at home after discharge, as written on the prescription or discharge summary. Example: The medication schedule was written clearly on the discharge summary, morning and evening with food.
Term 9. Clinical Handover. We covered this in episodes 4 and 5. The structured communication of a patient's care from one clinician or setting to another. Here it means the hospital team handing care back to the GP with the discharge summary as the key document. Example. The discharge summary completed the clinical handover from the ward to the GP.
And Term 10. GP Referral. A formal communication from the hospital to the patient's own GP, informing them of the hospital episode and requesting ongoing community care. Not the same as the discharge summary, the referral is specifically addressed to the GP. Example. Dr. Bennett sent a GP referral letter the same day as the discharge, so the GP was informed before Mr. Davies arrived home.
10 terms. Every one of them is in the role play coming up.
Let's get to it. All right, time for our role play. I'll be Mr. Davies today, back in hospital, bag packed, waiting to go home.
And I'll be Dr. Patel. Let's go. Good morning, Mr. Davies. How are you feeling today?
Much better, actually. Ready to get home.
That's good to hear. And you will be going home today. I've just been reviewing your results and everything looks clear. I wanted to sit down with you and go through it all before you leave.
The MRI, is it all right?
It is. The MRI came back clear. There's no structural abnormality. In plain English, the scan didn't show anything that shouldn't be there.
So, nothing serious?
Nothing serious. What we're looking at is tension-type headaches. Very common, very manageable. The dizziness and the severity of the headaches were what prompted us to investigate further. And I'm glad we did, because now we have a clear picture. The scan rules out anything more significant.
That's actually a huge relief.
I understand. I know the wait has been difficult. Now, before I discharge you, I want to go through a few things. Your discharge summary, your prescription, and some instructions about what to do at home. Does that sound all right?
Of course.
So, diagnosis. Tension-type headaches. The management plan has 2 parts. First, a short course of pain relief. I've written a prescription, and I'll explain that in a moment. Second, some lifestyle adjustments. We'll go through those. And third, a follow-up appointment with your own GP in 2 weeks.
Do I need to come back here?
Not routinely, no. The discharge summary goes to your GP today, so they'll be fully briefed. That's your clinical handover, essentially. The hospital passing your care back to the GP with all the information they need.
Right.
Now, your prescription. I've written you a course of pain relief. The name and the schedule are on the prescription itself and on the discharge summary. Take it with food, as it says on the label.
Is this a long-term thing?
This is a short course, to manage the headaches while you adjust some lifestyle factors. It's not a permanent medication. Your GP will review it at your follow-up appointment in 2 weeks and decide whether to continue, adjust, or stop.
All right.
Activity restrictions. For the next 2 weeks, I'd like you to avoid anything physically strenuous. No heavy lifting, take it easy with exercise. You can drive as normal, because this isn't a condition that affects your ability to drive.
Good. I was worried about that.
No need. Now, wound care. You had a cannula in your hand for the drip, so there may be a small mark. Keep that area clean and dry. If it becomes red, swollen, or warm, let your GP know.
I'll keep an eye on it.
Now, the important part. Warning signs. These are the symptoms that would mean you need to seek medical attention immediately. Don't wait for a follow-up appointment.
Right. What should I look out for?
Sudden severe headache. Much worse than anything you've experienced before. Visual disturbance. Blurred vision, double vision, or loss of vision. confusion or difficulty speaking, weakness or numbness on one side of your body. Any of those, go to A&E immediately or call 999.
Got it.
It's unlikely. The MRI gives us a clear picture, and these headaches are tension type, not a sign of anything structural, but these are the warning signs I always give to patients, so you know what to watch for.
And the follow-up? Where does that happen?
With your own GP, Dr. Bennett, yes? I'm sending a GP referral letter today alongside the discharge summary. By the time you ring to book, she'll already have the full picture.
That's reassuring.
Right. Let me hand you the documents. This is your discharge summary. It has everything we've discussed: the diagnosis, the treatment plan, the medication schedule, the activity restrictions, the warning signs, and the follow-up details. This is your prescription. Take it to any pharmacy. And this leaflet covers wound care.
Thank you, Dr. Patel, for everything.
You're very welcome. Take care of yourself, Mr. Davies, and if anything worries you before the 2-week appointment, don't hesitate. Ring the GP surgery, or, if it's urgent, come straight back.
I will. Thank you. 3 key exchanges, a little more slowly. Listen to how Dr. Bennett delivers clinical information at patient level. Precise, but never alarming.
Pay attention to the register and to the vocabulary. The MRI came back clear. There's no structural abnormality. In plain English, the scan didn't show anything that shouldn't be there. What we're looking at is tension-type headaches. Very common, very manageable.
So, nothing serious?
Nothing serious. The scan rules out anything more significant. The dizziness and the severity of the headaches were what prompted us to investigate, and now we have a clear picture. Warning signs. The symptoms that mean you need to seek immediate medical attention. Sudden severe headache, much worse than anything before. Visual disturbance. Confusion or difficulty speaking. Weakness or numbness on one side. Any of those, A&E immediately or call 999.
Is that likely?
It's unlikely. The MRI gives us a clear picture. These are tension-type headaches, but these are the warning signs I always give patients, so you know exactly what to watch for. Your discharge summary, your prescription, and your wound care leaflet. The discharge summary goes to your GP today. That's the clinical handover, the hospital passing your care back with everything she needs to know.
And the follow-up?
With your GP in 2 weeks. I'm sending a GP referral letter today alongside the discharge summary. By the time you ring to book, she'll already have the full picture. Don't hesitate to come back if anything worries you before then. Right, let's break that down. 5 things worth looking at closely.
Discharge vocabulary, register switching, and a few distinctions that learners consistently get wrong. Point 1. Discharge. Noun, verb, and why it matters.
In the role play, you heard discharge used 2 ways. Before I discharge you, that's the verb. The doctor discharges the patient. Ready for discharge, that's the noun. A state, a process, an event. Both forms are standard, and you will hear both constantly in hospital settings. In documentation, you'll also see patient discharged, passive voice, past tense. In OET Speaking, being able to move fluently between these forms. Mr. Davies is ready for discharge, and we're going to discharge Mr. Davies today, is a marker of genuine clinical fluency. Point 2. How doctors frame warning signs.
Listen to how Nadia delivered the warning signs. She didn't say, "You should be worried if." She said, "These are the symptoms that mean you need to seek immediate medical attention." That framing is deliberate. Clinical English for warning signs uses direct, action-oriented language, not hedging, not alarming, but clear and specific. Go to A&E immediately. Call 999. The verbs are imperative. The threshold is named. And she ended with reassurance. It's unlikely, but these are the signs I always give. The structure is specific symptoms, specific action, reassurance. Learn that pattern. Point 3. Follow-up. 3 grammatical forms in 1 episode.
You heard all 3 in the role play. Your follow-up appointment, hyphenated adjective modifying a noun. The hospital passing your care back, that's the concept of follow-up as a process, not yet using the word. We'll follow you up at your GP, and that's the verb phrase, to follow someone up. 3 forms. Follow-up appointment as noun phrase, follow-up as adjective, follow-up as verb. In spoken clinical English, follow you up or follow up with your GP is the most common verb form. In written documentation, patient to be followed up in clinic. Know all 3. Point 4. Register switching. How Dr. Patel translated clinical into plain English.
Watch the moment Nadia said, "There's no structural abnormality," and then immediately followed it with, "In plain English, the scan didn't show anything that shouldn't be there." She flagged the register switch explicitly. In plain English is a clinical signpost. It tells the patient that what follows is the lay translation of what just came before. This is a core skill for OET speaking. Examinees who can say the clinical term and then offer a lay explanation demonstrate exactly the register awareness the test is looking for. Practice the pattern. Clinical term, in plain English, lay explanation. Point 5. Discharge summary versus prescription. 2 documents, 2 functions.
Learners consistently conflate these 2. The discharge summary is the complete clinical record of the hospital stay, diagnosis, treatment, follow-up plan, medication changes. It goes to the patient and to the GP. The prescription is the authorization to obtain a specific medication from a pharmacy. One tells the story, the other unlocks the medicine. In the role play, Nadia handed Mr. Davies both, separately, and named them. In clinical practice, patients often confuse the 2, and clarifying the distinction is part of good discharge communication. In OET writing, the discharge letter is essentially a structured version of the discharge summary. Knowing the distinction is directly examinable.
5 points. That is the breakdown. Quiz time! 3 questions. Nadia, ready?
Always.
Question 1. What is a discharge summary, and how does it differ from a prescription? 5 seconds. Think before you listen.
A discharge summary is the written document that summarizes the complete hospital episode. Diagnosis, treatment received, medication changes, and follow-up plan. It goes to the patient and to the GP. A prescription is the specific authorization for a medication. It goes to the pharmacy. One tells the full clinical story. The other unlocks a specific medicine. 2 separate documents, 2 separate purposes.
Question 2. Name 3 examples of warning signs a doctor might give a patient at discharge. 5 seconds.
From the episode, sudden severe headache, much worse than anything previously experienced. Visual disturbance, blurred, double, or lost vision. Confusion or difficulty speaking. Also, weakness or numbness on one side of the body. Any one of these means immediate medical attention, A&E or 999. Warning signs are the specific threshold symptoms that sit between monitor at home and return immediately.
Question 3. What does follow-up appointment mean, and why is it important after a hospital discharge? 5 seconds.
A follow-up appointment is a scheduled consultation after discharge with the GP, a specialist, or a clinic to monitor recovery and review results. It is important because discharge marks the transfer of care back to the community. The follow-up closes the loop. It confirms recovery is on track, adjusts the treatment plan if needed, and ensures the patient isn't left without clinical oversight once they leave the hospital.
3 questions, 3 clear answers. The PDF transcript has all 10 vocabulary terms, the full dialogue, and the language notes. Link in the description.
That is episode 6. Mr. Davies is going home. Discharge summary and prescription in hand, follow-up booked, and clear on his warning signs. Next week, we step into a completely new setting. Episode 7. Allergies and medications. We're back at the GP clinic for a medication review, and the vocabulary gets more specific. Medication names, allergy categories, adverse reactions. A challenge, and a very useful one.
See you next week!
See you next week.